Honourable Member for Edmonton Strathcona, followed by the Honourable Member for Calgary East.
Thank you, Mr. Speaker. In January 2008, conveniently on the eve of the last election, the Premier claimed he would create 600 new long-term care beds. However, the true plans of the most secretive government in Canada were brought to light in a leaked document that our caucus released in September, a report that called for the closure of thousands of long-term care beds. To the Minister of Health, how can he explain the difference between what the government says to the public and what they ask the staff to plan behind closed doors?
The Honourable Minister.
Well, Mr. Speaker, as the Premier outlined in the House earlier, we believe strongly on this side of the House that you create a health care delivery system where you take the care to the patient and not make the patient fit into some system that some group has designed that may very well be out of date. So what we have in this province, Mr. Speaker, what we are moving towards is a continuum of care. And in places where seniors reside, it may be their own home, it may be a lodge environment, it may be assisted living. We're going to offer the opportunity to provide care in that facility where that particular patient feels more comfortable. And if that's not good enough for those who are advocating on behalf of some of their supporters who happen to fund them, well, that's just too bad, Mr. Speaker.
The Honourable Member.
Well, Mr. Speaker, there are about 800 senior citizens right now who would prefer to be in a long-term care bed and they can't get one. Meanwhile, services that are critical to seniors' health, which are free in long-term care patients, will be transferred to assisted living facilities, and those services will be part of a $1,000 a month special service contract when those seniors live there. So what will the Health Minister say to the seniors who simply will not be able to afford the care they need in the place that they did not ask for, that this government forced them into by cutting long-term care beds?
The Honourable Minister.
Mr. Speaker, any senior that needs health care gets health care. That's part of the system, the universal, publicly funded health care system that we have in this province. And I would challenge that particular member to get out of the city of Edmonton, travel this province, visit some of the facilities that our seniors are living in, and see the care that's provided in those facilities, instead of listening to these dredged-up reports that are sometimes a decade old, that seem to be the genesis for scaring people, fear-mongering, political rhetoric. I could go on and on and on, but that's what it is.
The Honourable Member.
Well, Mr. Speaker, the report I'm referring to is actually 6 months old, not 10 years old, A. And B, just last week I was in Medicine Hat where I was told that not one person in long-term care could possibly survive in a meaningful, healthy way if they were asked to be in assisted living. So, during the election, the government made grand promises to care for our seniors, but once they got behind closed doors, they abandoned them. Why won't the minister, once and for all, stop his secretive plan to download costs onto the backs of Alberta seniors?
The Honourable Minister.
Well, Mr. Speaker, my guess is that the people that member was talking to probably belong to a public sector union or the so-called enemies of Medicare or one of these groups that is just part of their little organization out there, Mr. Speaker. I hardly doubt that member even bothered to venture into to visit with seniors in a particular facility. Last week in Lethbridge, with the member for Lethbridge West, we visited a facility that I challenged the member for Lethbridge East, whose constituency it resides in. There is not one member of this Assembly, Mr. Speaker, who would not die to have that particular facility in their constituency.
The Honourable Member for Calgary East, followed by the Honourable Member for Edmonton Centre.
Thank you, Mr. Speaker. Mr. Speaker.
Keep trying. Keep floor.
Thank you, Mr. Speaker. The Calgary City Council and NMAX are united in